Alrighty, everyone. It is that time. I want to go ahead and welcome everyone to the Retail Strategies for Success Now and After COVID-19 webinar. Now, we know your time is extremely valuable, probably now more than ever before, so we appreciate your support. And so much support that, by the way, our audience has filled up 2 sessions for this webinar already with over 200 registered participants. So we really appreciate the support. As far as what's to come today, we've got a ton of valuable information and insight planned for you today, and it's been created by Drive's team of regional sales directors. Now, a little housekeeping before we begin. You may have noticed that your microphones are not turned on and that our presentation using Adobe Connect is being delivered over voice over IP, or simply audio and video through your internet connection. However, we will be looking to get our audience involved early and often, and we'll discuss more about exactly how to do this shortly. One more piece for housekeeping. If you happen to be having any Adobe issues on the Adobe Connect platform, please reach out to Dave Purdy. He's our tech support specialist at dpurdy@drivemedical.com. That's D like David, P like Peter, U, R like Rita, D like David, Y@drivemedical.com. He is standing by for any troubleshooting support. And that email is also in the notepad reference on your screen, in case you need that. Now that we've addressed the housekeeping, allow me to introduce myself. Now, my name is Eddie Faber, and I'm the National Sales Trainer for Drive to Vilbus Healthcare. Before transitioning over to the training side at Drive, I was a Drive sales rep covering the beautiful Rocky Mountain territory. And even before working with Drive, I did spend a few years working as a sales rep for a local DME in Chicago. Now, we know how overwhelming these unfamiliar times are for everyone, really both personally and professionally, and we want you to know that we are here to support you in just any way that we can. We've been busy working from home, brainstorming ways that we can help our customers not just survive, but grow their businesses coming out of this quarantine. That's why we have organized this series of webinars, which is just chock full of insight, best practices, and resources. Let me shine some additional light on the Drive Cares program. Now, today's webinar is going to be the first in a series we're launching today as part of the Drive Cares initiative called Hope Drives Us Forward. The Drive Cares program is committed to putting the latest education, the latest evidence and concepts in your hands so you and your business can thrive both today and tomorrow, helping you to do what you do best, which is to maximize outcomes for all of your patients. Today, we're going to be talking about retail strategies for success now and after COVID-19. And we'll share some information about some other webinars in this series later in this presentation. We are very fortunate to have 2 Drive regional sales managers with us today to speak to this topic. So allow me to introduce you to Nathan Brumbaugh and Cale Wadden. Now, Nathan has 15 years in the home healthcare industry, 6 as a DME retailer, and now 9 on the manufacturing side with Drive. Cale Wadden has worked in a variety of clinical settings as a local DME provider for years before joining Team Drive up in Canada, and now actually sits on the board of directors for the Canadian Occupational Therapy Foundation. Nathan and Cale are the best of the best when it comes to helping our customers maximize revenue by thinking outside the box, and they are really fired up today to have the chance to present on this topic today, and they have been studying it for years. We'll hear from Nathan and Cale in just a moment. Our objective for the next 30 minutes or so is to help our audience learn how to capitalize on post-quarantine retail challenges and opportunities. Now, as promised, we're going to get our audience involved throughout this presentation as we're interested on your thoughts on the subject that we'll be discussing. So let's practice that and jump into our first interactive poll. Now, we're interested in hearing from you, our audience. How have your retail sales looked in 2020 compared to 2019? Are they up? Are they down? Are they about the same? As you guys are making your selection, I'm going to pass the microphone to Nathan, and Nathan's going to discuss the results of our first poll. Nathan?
Yeah, thanks, Eddie, and thanks for the warm introduction. More importantly, thanks for all the participants on today. We're excited to be able to present to you today on a relevant topic that we're, as Eddie said, we've been focused on trying to develop some content for you guys. So, we got our first poll on asking, are your retail sales for 2020 up, down, or about the same in 2019? I see several results coming in here. I'm going to go ahead and broadcast those results. Looks like we have about 26, 27 participants here. Based off our first poll, it looks like majority of this group is stating that their retail business is down. Now, that may not come as a complete shock given how 2020 has started, but I do appreciate you guys' participation. When looking at the onset of COVID-19, we know wages were cut, millions were furloughed, and according to the National Bureau of Economic Research, they reported we lost 22 million jobs in March and April. But job losses weren't the only thing affecting our consumers. Many state and federal regulations force people to stay at home, and depending on your state or province, these regulations still may be affecting your business. Additionally, many consumers, especially those with elevated health risk, were less likely to get out and shop at retail businesses.
Nathan, just jumping in here real quick and saying a quick hello, especially to quick shout out to my favorite Canadian customers who joined on today. Thank you. But in regards to the slide here, just a little bit of food for thought. I mean, we know times have been tough, and so tough that the Wall Street Journal published that roughly 100,000 stores are expected to close over the next 5 years. 100,000 stores. Now, although these are large brick and mortar retail stores such as JCPenney, Pier 1, Neiman Marcus, among others that have filed for bankruptcy, Neiman Marcus specifically has also furloughed many of its roughly 14,000 employees. Nathan, 100,000 stores. Is this what we're really talking about today?
Absolutely. We're here to make sure that no one is part of that statistic. Looking at this survey responses from a COVID-19 questionnaire done by AA Home Care, we know that many DME providers and retailers reported additional business activities that added significant operating costs to their business. 92% of the respondents indicated that they had to invest more time cleaning and sanitizing their facilities. The data also shows more DME was drop shipped and more money was spent on advertising and PPE. Think about the challenges that you've experienced over the last few months. These unexpected expenses all came with cost. Let's preview today's agenda. We will be taking a deeper dive into consumer impact by looking at some buying trends, retail foot traffic, and new customer expectations. We will illustrate some strategies and best practices around curbside services. We will share some e-commerce and big box retail data, along with marketing strategies as a way to think differently about your dropship program. We will discuss how virtual technology can be used to stay connected to your customers and help generate revenue for your business. And lastly, we'll discuss some of the tools and resources drive offers to help your retail business. Let's start by looking at some consumer buying trends. When the pandemic first broke, many consumers raced to the toilet paper and food aisle as a fear of missing out on their essential items. Then we saw this huge shift into home improvement due to more people not being at home with more time on their hands. I know personally I had to pick up a screwdriver and a paintbrush a couple times over the last few months. This summer, the big trend looks to be around outdoor and recreational equipment as less consumers are feeling comfortable getting on planes and cruises. We can also see this consumer behavior change by looking at retail foot traffic. For example, Lowe's saw an increase of over 50% in retail foot traffic through April and May, while many other retailers listed on the slide also saw increases as much as 30% or greater. Let's take a quick poll. How many of these types of home improvement or discount stores have you visited over the last 60 days?
Oh, Nathan, if I got to start talking about the amount of times I've gone to go get potted plants here, these results might be pretty skewed, I think.
Yeah, I'm going to go ahead and broadcast the results. It looks like you're not alone. Based off the poll results coming in, it looks like about 55% of the audience today has visited 2 or more of these types of businesses. So again, thank you for your engagement on the polls. So knowing that, what were your expectations as a consumer and safety concerns when visiting these type of retailers? In other words, how are you advertising to your customers your sanitation practices that are in compliance with CDC and health and safety guidelines? How are you advertising your contactless delivery, drop ship, and pickup services? Many businesses have started advertising and promoting social distancing. I know my local grocery store here in Arizona has like these little red mats or mats on the floor right at checkout, which are about 6 feet apart to help provide some guidance to their customers. And some stores have even widened their store aisles for the comfort of their customers, or even just created one-way aisles. And lastly, we're seeing businesses starting to promote virtual services used for consultation and educational selling. Understanding some of these new customer expectations, let's drill into our first takeaway.
So, Nathan, great introduction here before we get into the real meat of the webinar here. I mean, everyone and their dog has been doing curbside business, at least a little bit. But, you know, people that are on the webinar today, they want to know how to get more. So how do you become the leader in curbside pickups? So, you know, before we answer that, let's pause here and take another quick poll. I know the engagement's been good here to see what this group is doing to market their curbside services.
Sure, please select all that apply. How are you advertising your curbside services to your customers? Are you using your website, your storefront? Are you using your delivery technicians? What about direct marketings like flyers and catalogs that get sent out? Are you pushing it through your social media platforms? Or are you using the traditional email blasts?
We're moving more and more into a digital world these days, and it's interesting to see how people move from their traditional ways of advertising into these new times.
Yeah, let's go ahead and broadcast those results. Looks like we got a lot of participation here. So again, thank you all for the participation. You know, it looks like from this group, majority of the advertising done is really at the retail storefront, along with social media. And it's exciting to see how many people are using their delivery technicians, which are really the ambassadors to the business, the first contact with a lot of their customers, as well as their websites. So again, I really appreciate the participation in all these polls. And it's exciting to see all the different ways and different marketing strategies to keep your customers informed and connected there. So I know we just mentioned, you know, advertising here or marketing, but I do want to point out, and I know the poll said about 48% of you are using your website. So for the other half, I guess I'm just surprised by the number of providers that do have active websites but don't have banners on their homepage spotlighting contactless curbside services or even their top selling COVID items. or even a link updating customers on their current policy changes, whether that's your returns policy change or just precautions and prevention protocols. Other ways of maximizing your curbside is offering discounts for customers that pick up at specific times, such as first thing in the morning. You think there's some operational efficiencies if you can get your customers to pick up first thing in the morning, and there's great value for your customers by taking advantage of some discounts and feeling more secure and safe during those pickup times. Also promoting things like your touchless payment options at Curbside, such as Apple Pay, Google Pay, and Square. And lastly, really transforming that curbside service into a new shopping experience at time of pickup. Let's take a look at one of these examples. If your customer came in to pick up and buy a nitro, are you up carrying the cup holder? Are you offering the impulse buy? These are the items that are typically by the register at checkout, like the hand sanitizers, gloves, masks. Are you cross-selling them with items that correlate with their needs, such as an elevated toilet seat? And lastly, how are they paying? Using the example we just illustrated, there is potential of roughly $60 in unrealized revenue. Here's another example, using a bath chair with roughly $45 in add-on sales. Your daily curbside sales are full of opportunities to upcare and cross-sell. More than likely, you're already doing this when they come inside. Reinvent yourself in the parking lot. We know teaching is the new selling and no one wants to be sold to. But by matching the right products to the patient's needs and wants, you can truly brand your business as the expert. This is the fundamental way to differentiate your business over e-commerce and big box retailers. How are you teaching your customers about the products that will better provide safety, independence, and mobility in their lives? How are you capitalizing on this opportunity? Before we move on, I'm curious. On average, how many curbside pickups does your business do per day? The answer is there are none. There's obviously some room for improvement. It's an opportunity for some new revenue streams. 1 to 10, still maybe room for improvement based on the size of your business. Every business kind of got different locations, multi-state or just single location. 11 to 20, 21 to 30, or are you crushing curbside and doing over 30 deliveries per day? I see a lot of the results coming in, so I'll go ahead and broadcast that again. Appreciate all the participation in the quote. It looks like majority of this group is between 1 to 10. We do have a few all-stars in there, sitting there at 31 or more. So I, again, appreciate all the participation. So what could maximizing your curbside look for your business? I mean, we just took a poll, and it looked like majority of the group was between that 1 to 10 range. We did see some hovering into that 11 to 20. So this might model out well for your business here. If your business is doing 12, or in some cases of the superstars doing 30 on the call, if you were able to get half of those orders and we're able to upcare or cross-sell approximately $50, that would be roughly $94,000 a year in revenue. For those people doing over 30, that's significantly more. Can your business afford to miss out on this $94,000 a year? Take a look at CVS and how they've adapted during the quarantine. They saw a decline in foot traffic as less consumers wanted to come inside the store, but people still needed prescriptions. So naturally, they started cross-selling more items at their drive-through window.
So just last week, as a real life example, I went to the pharmacy for one thing, my prescription, and they did exactly this. So then as soon as I got the prescription, they then started asking me about my pain relief, then skincare, allergy relief, cold relief, digestive care. They knew that they are at the risk of losing these sales to e-commerce and online grocery store orders. So they increased what items could be purchased at the drive-through window. This is what we're talking about when we say we need to capitalize on curbside pickup.
Absolutely, Cale. And cross-selling and up-carrying isn't a new idea. I mean, take this example outside of our industry for a minute to the last time I bought a suit. I recall the associate quickly taking my measurements, fitting me for the right jacket and pants, and while I was in the dressing room trying them on, the associate began pairing the dress shirt with a tie, a pocket square, a dress shirt, and the pants with a belt, a pair of socks, and some shoes. I mean, really, his job was to inform me and make me aware of all the complementary items that would be appropriate for the suit. After all, it would have been terrible if I got home and realized I didn't have the appropriate accessories for my evening out. This is no different than our industry, only we're selling a bath chair with a shower head, bath mat, and suction grab bars.
So just a quick note on this topic. We're already seeing a few positive examples on this. And we have a few customers up in Canada who have multiple store locations. And they decided to spin this concept a little differently with their internal staff. So oftentimes, staff don't like to, quote unquote, up care because the staff feels bad about people having to spend more money, or they'll even tell customers to come back on a senior's day when it's an additional 20% off. It's been a traditional issue. So now that they've been explaining up caring to their staff as, please offer up carrying items at the time of the purchase, and explain to the consumer that this may prevent them from having to come back to the store and having to take COVID precautions and ultimately be inconvenienced. So by them changing the narrative to their staff, who are now changing the narrative to their clients, their consumers, they're having much more success on generating more revenue as well as positively affecting their clients' lives.
Yeah, Cale, I mean, great example, and I do appreciate you sharing how one of your customers started thinking differently about this up-carrying and cross-selling. We know by tailoring your business solutions to each of your customers, it can help improve customer loyalty and ultimately your bottom line. For those of you who are not maximizing your curbside options, how are you capturing customers that are not going into stores?
So, interesting question, especially just after discussing how to maximize the curbside pickups. Now, before the quarantine hit, I would sometimes get reactions from our customers like, Cale, I'm pretty sure we have the majority of the business in our region or territory, or Cale, my reps never want to sell those items because they don't make a whole lot of commission. Nathan, take me down a path with some insights on what's happening online.
Sure. Let's take a quick poll first. Everyone's been so engaged so far, so why not? What has been drives, in your opinion, what has been drives e-commerce retailers' top selling item online over the last 60 days? Answers are you got a cane in there, a wedge pillow, walker basket, and bath seat. See a few responses here coming in. I'll go ahead and broadcast those right now. It looks to be pretty even between canes and bath seats, kind of changing here. A lot of good guesses. But surprisingly, it was the one that was least guessed. Would you be surprised if I said that the walker basket has been Drive's #1 item online?
Yeah, this makes total sense. So You gave the example earlier of people talking about the cup holder when providing the nitro rollator. So when you think about the amount of consumers that are staying inside with a two-wheeled walker right now that's already been purchased in the past, how are they supposed to transport their lifestyle essentials? The pandemic made them realize that they're unable to take their belongings from one room to another. So how are people that are independent on you take their tea and coffee from the kitchen or their phone from their chair? Do they stop this once they get a walker or rollator? What can we learn from this buying trend? Data shows that while foot traffic was declining with some brick and mortar and big box retailers at the early start of the pandemic, the e-commerce sector overall saw a proportionate increase in online traffic. Nate, show us what's going on here in this one.
Yeah, by looking at revenue over the last 60 days versus 2019, overall we saw a decline in mobility aids due to elective surgeries being limited, less auto accidents, and sports injuries. While at the same time, we saw patient room and bath safety continue to rise, in large part to do with more people staying safe at home and focusing on self-care to enhance their lives with items such as bed wedges and those walker baskets.
So, just going to circle back here on the walker basket, as it's clearly a missed revenue opportunity. We know that complex rehab and the high dollar items are always top focus. But how many times do we try and remind people, not only is it a revenue loss, but now that we know they will go and buy the item somewhere else, the likelihood of you, the provider, getting that complex rehab sale just shrunk. I spoke to a complex rehab rep last week when I told him the walker basket was the #1 selling item. He laughed and goes, I had 2 people in the store, Kale, last week, asked me for one of those, and we didn't have any in stock.
I mean, that's a great example of, a product that, might be getting underutilized. And I think, Kale, you did a great job on explaining the why people are starting to purchase that more. One other item that has seen a large increase in sales is our 3-wheel rollator. What's interesting about this item is how the marketing of this product has changed over the last few months. One of the large e-commerce companies started to brand this product as great for indoor use. Carol, as an occupational therapist, what do you think about the way this is being rebranded?
The 3-wheeled walker rollator it's really underutilized in my clinical opinion. And although there's a fear that this style is quote unquote unstable, this is a great product for the right person. It's lighter weight than a standard 4-wheel rollator, which makes it easier to push, manages a consumer's fatigue a lot better, and is ultimately a lot easier to transport. And as you can see on the slide here, it has that unique triangular frame design, which also makes it easier to navigate through narrow spaces like a galley-style kitchen in a condo or apartment, along with small bathrooms and bedroom spaces. But there are a ton of other non-clinical examples as well.
Yeah, this is probably my favorite example of how one big box retailer started to kind of rebrand products differently. They took the overbed table, which is typically perceived as a medical device, and with majority of people starting to work at home, relabeled it as a rolling desk. Knowing that business professionals are wanting to stay active while working at home, they started pushing the exercise peddler as a cross-sell. They saw a lift in both the products and a new customer demographic. Listen, maybe it's not a rolling desk to your customers or in your market, but maybe it's a CPAP table. Kel, you had another interesting example of this.
Love the CPAP table idea. Who wants to see an ugly CPAP machine on their nightstand all day long? I mean, simply use a bedside table and move it in and out of the room whenever needed. But we had a large pharmacy chain retailer that looked at their business, and I quote, they said, "We need to start doing what's necessary, then do what's possible, and suddenly you are doing the impossible." And this is actually a real photo from the customer I'm speaking of. And this idea stemmed from the success of a U.S. camping retailer who sells folding commodes. And they branded them differently now that there's a big focus on camping close to home.
Yeah, in each one of the examples we just illustrated, we saw how e-commerce and big box retailers started to factor in the lifestyle changes of the consumers and started thinking kind of outside the box. And by doing so, they saw an increase in sales as the result.
So thanks for bringing up the outside the box thinking with the big box and retail examples. But we've also seen some out of the box thinking when it comes to the use of virtual services. But there's been an increase in use such as Instacart and other grocery services. So Nathan, what are the growth insights when it comes to people capitalizing on the online platforms?
Well, we know that 41% of the shoppers bought food online for the first time during the early phase of the pandemic. Personally, I know I downloaded my local grocery store app, which now offers me these incentives and product discounts, but it really was for that contactless pickup. We are seeing a lot of other industries starting to use virtual services such as FaceTime and Zoom to connect with their customers. In other words, social distancing doesn't have to distance you from your customers. Many already offer training and education. It's time to make it virtual. Keep being an integral part of your customers' lives and stay connected. How can you leverage this consumer's new comfort level with many of these virtual services to create a new revenue stream? With COVID-19 impacting skilled nursing facilities and alternative living, we're seeing more elderly parents start to move home with their loved ones or their children, and it's their children many times that are being tasked with making sure that their living arrangements are safe. Virtual services can help with these transitions and continue to brand you as a local, trusted provider. Listen, our goals are in line with yours. We don't want anyone to become a statistic. Let us help bring value to your business and consumers. Start preparing now by taking a deep dive into your operations, products, customer data, and use this information to roll out the best products and pickup and delivery options for your business.
Okay. So let's tie all this together now. First, we maximized, then learned what is happening outside of brick and mortar. Then Nathan, you took us down the path of incorporating the virtual platforms. Now, the big question, how can a partnership with us, Drive Medical, go past price and product to help your business? We offer additional tools, resources, and personnel to help train and develop your teams. In the example shown here, we have a step-by-step guide on how consumers, your existing staff, referral sources, and funding agents can get the right raised hold seat the first time. So please contact us, Nathan, myself, your Drive representatives, and your Drive counterparts for not only from the examples we just provided, but for your ideas. We want to hear from you. We also have the content. We've done all the heavy lifting here. We're just asking you to share. So it can be a full-time job in itself to come up with fresh, compelling content day in and day out. We have consumer-friendly product videos on our Drive Cares website and the Drive Medical YouTube channel, which can be used for consumer education. You really should start driving content on your existing digital platforms like your website, LinkedIn, Facebook, Instagram to become that destination for more information. How does your current content trigger a person to recognize your business in a time that they need help?
That's a great question, Cale. And I hope this question, along with many of the others during this presentation, have challenged you to think differently about your business. Let's recap. We discussed insights and data around COVID-19's economical impact on customers, their buying trends, their lifestyle changes, and expectations during the early phase of the pandemic. We started talking about what you can do today, such as transforming your curbside into this new shopping and selling environment. Using the data we shared about what's being drop shipped online and how some of these companies are starting to market their products differently and capturing new sales and demographics. We also discussed utilizing technology and online platforms to connect with your customers and create new revenue streams for your business. And lastly, we touched on a few of the many resources and tools drive offers to our provider partners. I hope this presentation gave you several things to think about and ideas to prepare your retail business for the next business disruption. Eddie, I believe you have one last poll for this group, and it should help us help you. But before I turn it over, on behalf of Cale and I just wanted to say thank you all for your time and support in this presentation.
Excellent. Tremendous job, Nathan and Cale. I want to thank our audience as well for just some awesome engagement throughout. We've got one final poll question for you, as we want to continue providing as much value as possible in future webinars. So we want to hear your feedback. Tell us what comes next. Which topic would bring your business the most value? Would it be something around social media and marketing? Maybe you're interested in more on curbside pickup and operations. Maybe virtual consultations and education piqued your interest. Or if it's something that is not listed, we will be sending out a post-webinar survey and you can list it there. Just in case you're curious about what your peers want to hear and see next, as far as value to their business, looks like a majority of our audience wants to see more around social media and marketing 201. Excellent. One last message here for our awesome audience. We wanted to let you know about a couple upcoming free webinars that we're delivering as part of the Drive Cares program. On June 23rd and June 30th, we'll be presenting a webinar titled Group 2 Support Surfaces, where we'll be answering the question, why now? And then on July 8th, I'm sure many of you have respiratory concerns. We'll be talking about how to ease those respiratory concerns after COVID-19 and answering the question, now what? We hope to see our audience on future Drive Cares webinars. One last thank you to our awesome speakers, Nathan and Cale, and to our audience. We can't tell you how much we value your support. As I end this webinar, you will be automatically taken to a short survey monkey, where again, your feedback will help us to maximize how we deliver this content to you all in the future. So please take a couple minutes to complete that. With that, this concludes our webinar. Thank you again, and enjoy the rest of your day.